you so much for joining us today. This is a part of the Yonkers Public Library COVID documentation series. We are now in, I would say, what is coming as a second wave of the coronavirus spike of the year 2020. And today we have Cilin Phillips with us, who is a lifelong Yonkers resident and who I share a profoundly interesting relationship with, because I haven't seen or spoken to Cilin on this level since we were in grade school. We're now adults and we have careers, as you'll later learn, but interesting enough, Cilin has a career where he deals more hands-on with people who could potentially be vulnerable for COVID, or in fact, I don't know, maybe you can describe it for us, but thank you so
Sure.
much for being here, and thank you so much
Yeah, thanks for having me.
Be in the Yonkers Public Library History Incubator.
Which is pretty cool. I like that you guys are doing that. So I can touch a little bit about how it's affected me personally as a healthcare worker, working through COVID. So as I kind of mentioned, my day job or my normal job is I'm an orthopedic surgery PA. So I deal a lot with orthopedic care. But once COVID hit, especially in Manhattan, anything that was not emergency care or medical care, internal medicine care related, basically came to a halt. And it was all hands on deck for COVID. So very early on, when COVID hit and the hospital was getting overwhelmed, I was redeployed. I was one of the first ones to be redeployed. And essentially all of us were redeployed because orthopedic surgery at that point didn't exist anymore. And any of these subspecialties really weren't a thing because nobody was going to come into the hospital for an elective total hip replacement in the middle of a worldwide pandemic. And people that wanted procedures done or even had mild to moderate emergencies, anything that could be deferred was being deferred because we just didn't want to risk people coming in for those procedures. It was a risk to them. It was a risk to the surgeon. It was a risk to anesthesia team. So anything that was not COVID, if it could be deferred, it was being deferred. So unless you had an absolute emergency where, like, say you just fell and, your bone was sticking out of your leg, it was kind of being deferred until a later time. So
interesting. So in that, being deployed meant that you were going to the forefront of what was happening with COVID, or?
Exactly. Yeah. So over a span of 2.5 months, I was redeployed 5 times to 5 different jobs, teams, services, because my help was not needed as an orthopedic surgery PA because, as I mentioned, orthopedics was non-existent. So the first job that I was redeployed to was being part of what the hospital created, this PPE police, or so as you kind of know, protective equipment for hospital workers was a big thing when COVID first started because we were so short on supplies, but the demand was so high. So part of that was having to police this equipment and make sure that we were trying to ration it as much as we could, even though it was very suboptimal, but it was the definition of have something so that later on you don't have nothing at all, right? So I remember my first night working the PPE police, is such a weird name to me, down in the ER where I had to basically have this cart of protective gear, whether it be surgical masks like the one you're wearing now, N95 face masks, shields, gowns, and other protective equipment. And I had it in a cart under lock and key. And when someone wanted something, they would have to come to me and ask for it. And I had to deem whether it was necessary or appropriate and then distribute it as such, which is such an unpleasant job because protective equipment in the midst of a pandemic is basically your lifeline and your only hope when you're dealing directly with COVID patients. So I would hate to be the person to say, yes, you can have that, or no, you can't have that, or hey, I'm going to give this to you, but you have to make this last for the whole week.
But you
Which
were
is,
that person.
I was that person. I didn't want to be that person, but I had to be that person. And in the beginning, it was extra unpleasant because the shortage was so severe. I remember the first night they gave me only 10 gowns, and they were like, you have to somehow manage this. And I'm like, this is impossible because there's like 90 people here. How do you expect me to do this? I was like, you have to give me more. There's just no way. And when I did distribute something, I would say, listen, like, you kind of have to reuse this for the whole week. And they'd be like, that's gross and disgusting. And I'm like, yes, I agree with you. And I agree that this is suboptimal. But if we don't ration it this way, we will go through our supplies so fast that essentially you'll be left with nothing. And then when you need something, we just won't have it at all.
So they could take it home and wash it, or
No, so what we would do, for example, our N95 face masks and our face shields, what we would do is we would use it to go see a patient, and then afterwards we would like wipe it down and sanitize it when we were done for that time period. So we would put it on, go and see patients, and then say 3 hours from now we were going to take a break and leave that area for a bit. We would, there's terms used, doffing and donning, which is like putting on and taking off the gear. And when you would take it off, you would sanitize it and kind of store it somewhere, and then kind of reuse it when the time came to go back into that area. It was very not kosher, but like, it was just something that we had to do. And this is all stuff that was designed to be used for one time. Normally we put on a mask, we put on a face shield, we put on a gown, we go see one patient, we leave that area, all of it comes off, all of it goes in the trash, and then we keep it moving. This was putting all this stuff on, going and seeing all these patients, and then when not in that area, taking it off, sanitizing it as much as we could, holding on to it, storing it. I'd be storing these things in my locker for days, reusing them, sometimes for a week, sometimes two. So it was definitely not the most ideal situation and not the most sanitary situation. And obviously there's a lot of room there for cross-contamination. And, ideally these things are not meant to be worn between multiple patients. But when you don't have a choice because you just don't have the supplies, what else can you do? Right. So, and it was weird because this is your only barrier between you and somebody with COVID. So you're not going to not wear the protective gear, but at the same time, you're not using it in an optimal way. So it was definitely
did you have to wear protective gear?
All the time. Yeah. All the time. Even now we do.
Did they have to return their, I guess, what they, used gear to you?
No, they would keep it. It was theirs to keep. But that's why I would tell them, take this, use it, but when you're done with it, sanitize it, clean it, hold on to it, because we never knew what tomorrow brought. And so there's no guarantee that when tomorrow comes, I'll have a mask for you. And so hold on to this one because you don't know when the next one's coming.
So what happens if you didn't have a mask?
Luckily, we didn't encounter that situation where somebody needed a mask, we just didn't have one. Luckily, we never got to that point, and I'm glad we didn't have to find out what would happen if we got to that point. But that's also because we used things so sparingly and kind of made it where we reused everything as much as we could.
How many people were on your team, the PPE team?
So when I would do it overnight in the ER, there would probably be maybe 2 people in the whole hospital doing it overnight. I was down in the ER. I think there was 1 person up on the floors doing it. During the day, they had a few more stations. They probably would have 1 person on every floor. How many people in total were doing it, I don't know. If I had to take a guess, I would say maybe 10 to 15. So that was my first. Go ahead.
So you were going to say that was your first
redeployment assignment.
Redeployment assignment in all of your 7 years being in.
Yeah. So in my 7 years of working as an ortho PA, I was always an ortho PA. But when the pandemic hit, it was all hands on deck. there was no more, you're an orthopedic surgery PA. There was no more, you're a cardiology PA, you're a neuro PA. Like, that didn't exist, because everything that was not emergency medicine care or internal medicine care, you were non-existent at that point.
So you
Everyone
guys
needed
developed
to join
new.
the force at the front lines of where things were happening.
So how many
Because
different new teams were there?
how many, sorry, say that one more time.
How many different new teams would you say had to be devised?
It wasn't really more so new teams. It was just more so joining that department, because that's where the load was. So the ER, as you probably know, was getting overwhelmed. So they needed more help there. The internal medicine team, because if you came in with COVID, you came into the ER, and if you got admitted, you'd be admitted to the medicine team in the inpatient unit. So this is where all the help was needed. So that's where all the help went. There were some additional teams created. Like, one team I could think of was the PPE team, which I just told you about. Another team that was created was a prone team, which I was not a part of, but I had a lot of coworkers that were, where their job was to basically flip people in the ICU and stuff, like prone them. Like, so because there was benefits to rotating patients, and so they would basically go and help patients that were ventilated or very sick, turn around. There was a tent set up outside, a COVID tent, so there was staffing for that needed, because that was a tent that didn't exist before, which I'll go into more, because that was another redeployment assignment of mine. Yeah, there was, I know one of my coworkers had to help out in the morgue, trying to tag and bag bodies, because there was just so much of it, and even had to help like load bodies into a truck at night. So there was a lot of.
So you heard a lot of this firsthand, right?
And I experienced a lot of it firsthand, because I had myself was redeployed 5 times. So the PPE gig was just one of 5 different jobs that I had to do. So that was the first one that I had to do, which, as I mentioned, was not fun, because who wants to be that guy? Who wants to be the one to tell people, like, yes, you can't have this, and no, you can't have that? And when people get mad at me, I'm like, I don't make the rules. Like, this is not my decision making.
Oh my gosh, I couldn't even see you being in that role. Like,
right, exactly.
No, you cannot have your PPE. Like,
right.
You've always been a very giving person.
Of course. And it was just a matter of, we just had to really ration things to make it last. And then the second redeployment assignment that I had was, I was helping the ER techs, because they were so overwhelmed with the sheer volume of patients. Like, just even doing simple things like getting EKGs and drawing blood on all these people. If I could even help them do that kind of stuff, I was helping them with that role.
Any learning curve there for you?
Well, it's all stuff I've done before, but I just hadn't done it in a while. I mean, the last time I was doing that kind of stuff was when I was in PA school, I think. And so it took me maybe, I don't know, 30 minutes to kind of relearn that stuff. But then I was just like, okay, let me go ahead and do that. But it was just more of, because a lot of times practitioners may think, oh, this is like, I'm above this. I can't. Why am I got a license to practice medicine. Why are you asking me to do like a tech position? But like I said, it was all hands on deck. There was no job too big or small. It was, this is where we need help. Can you help? We're redeploying you here. And there were people that was even redeployed to do things like food services or things like that, Yeah. So, so that was my second assignment. My third one was, I was redeployed to the COVID tent outside. So there was actually a tent built and set up outside, because the ER was so overwhelmed that they needed a tent outside to kind of screen these patients before they came to the ER. Because majority of people that have COVID do not need to be admitted to the emergency room. Majority of patients that have COVID can just go home and self-quarantine and be okay. They don't need to come into the emergency room. They don't need to be admitted to the hospital. So if I could triage all these people that were coming to the ER because they said, I think I have COVID, or I'm scared that I have COVID, or I might have COVID. If I can triage them to say, hey, yeah, you may have COVID, but even if you do, you don't meet the criteria to be admitted to the hospital. So we're just going to send you home and you just make sure you self-quarantine for 2 weeks. We could decrease so much of the burden on the emergency room, because we wanted to save that for the people that really needed it.
Which majority for you of those people that came to the tent, even that were sickly enough to go into the ER, was there a particular demographic to you? Did you see any correlations?
No, I didn't notice a specific demographic, but I would say majority of patients that came to the tent were people that didn't need to go to the ER or didn't need to be admitted. Majority of them were people that can just go home and self-quarantine. Because if you think you have COVID, but you're asymptomatic or you have very mild symptoms, there's no point in you going to the ER or the hospital, because they're not going to do anything for you. There's nothing they can do for you. The issue is when you have COVID, if you have respiratory distress, so say your oxygen level decreases and you need supplemental oxygen, whether it be via nasal cannula or non-rebreather, or having a BiPAP machine, or even worse, being intubated, which is the most severe. That's when you need to come into the hospital, because you need help breathing, or you need medical help that you can't get at home. If you're asymptomatic or you have mild symptoms that doesn't need supplemental care that requires you to be admitted to the hospital, then you can just go home and self-quarantine yourself and you'll be fine. But it's when you come to the hospital and your heart rate is like in the 120s and your oxygen level is in the low 90s or in the 80s, where we're like, okay, we need to bring you in and we need to put you on oxygen and get your oxygen level back on track, and then slowly wean you off of it as you improve, and then hope that you get better and then you can be discharged home, type of deal. So those are the people that really needed to come in, and the others can be discharged home, or rather not even be admitted, but just be told, hey, just go home and self-quarantine yourself. And I noticed a lot of people that came in were really just afraid. I had one guy.
Not a lot of people, and still today, we don't really know what comes with COVID-19. You
Sure.
can pinpoint certain symptoms, right? And I guess this poses another question. While you were working outside of the tent, did the guidelines of what symptomatic meant, or how severe someone's COVID symptoms were, did that guideline change at all?
It didn't change. It stayed pretty uniform, but the tent wasn't really set up until a bit deeper into the COVID pandemic. So it wasn't like it was there from day one, where it had that kind of room to change as the other policies. So there were a lot of policies that did change. It was almost as if they were changing every few hours in the beginning, in terms of the requirements of protective equipment that we needed to wear, in terms of the policies of how we interact with patients. That seemed to be changing almost every few hours in the beginning, because, I hate to say it, but it was almost like nobody really knew what was going on. I mean, this was this thing that hit and everybody was just kind of caught off guard, and no one really knew what the right answer was. And we were trying to just make best educated guesses. But when you have something new that's happening and people don't really know what's going on, then you have that situation where things just keep changing and changing and changing and changing. But when I was in the tent, because the tent wasn't established until, halfway, at least a month and a half into COVID, that the guidelines were pretty set on that.
So that's in May, right? Like, what's April, May?
Yeah, I'm sure. I think so. March is when I was first redeployed, I believe. And then I would say probably the tent was probably set up by February, I would say. But I wasn't redeployed into the tent until, I want to say, like mid-February, probably. And so I did that, and I did that overnight. A lot of my work, I work as an overnight orthopedic surgery PA. And so most of my redeployments were all overnight shifts because I was already somebody that worked nights. So when I managed the tent overnight, it was just me by myself in there. It was me and one nurse. And we would run this whole tent overnight, which seemed at times overwhelming, and also seemed very surreal. I think that was one of the moments where this thing really hit me, because I'm outside of the hospital in this tent, and it just looks apocalyptic. It looks like something out of a movie. And I'm like, is this real life? Am I really here? Am I in this movie scene looking thing right now where I'm standing in a tent all draped in gear as patients come in and being like triaged and quarantined and isolated? And it's just like, what is life right now?
And you are at the forefront of it. You feel that way, and you're literally in it. So imagine the people on the outside, like, you know, just regular community members who aren't seeing it firsthand, dealing with it firsthand. There's this rumor, as you probably have heard, that COVID isn't real, that COVID is bullshit or created by someone or something, government, you know, all these theories. What would you say to those people, considering you've been...
So I've had to have that discussion in the past, and I say, listen, like, I can only go by what I'm seeing and what I'm experiencing. And this is what I'm experiencing, and this is what I'm seeing. And I'm just seeing people die, like, left and right. That's not fake. You know, I can't talk to you from a political stance in terms of this. I can only talk to you from what I'm seeing and experiencing from a medical aspect of being in Manhattan, working through this pandemic. So that's really what I could do, was share my experiences.
Were you ever scared, Cilin? Did you ever feel like fear for not just yourself, maybe going home, you know?
Yeah, so I don't think I was ever personally afraid or fearful for myself. It was always for others. It was always, I don't want to risk getting something and giving it to my parents who are older. That, or, you know, giving it to my nieces or anything like that. And that's why I pretty much self-quarantined myself during that entire few months. I didn't go anywhere. I didn't see anyone. I didn't interact with people. And I'll go into a little bit more of that in terms of how it impacted me mentally from that standpoint. But to kind of go back to the initial thing, so this was my experience in the tent. And then my fourth assignment was just being part of like the ER staff, being an ERPA, which I like because now I'm back to my practitioner role. Like, I'm being able to see, diagnose, treat patients. And I was in the tent too. I was being a practitioner. And then my final redeployment was being a medicine PA, where I was on the medicine service for 9 weeks. And I was acting as a medicine PA overnight, dealing with the COVID patients that were admitted to the hospital, as well as new admissions coming in through the ER, and handling those as well. So I did that for 9 weeks. And it was just only 2 weeks ago that now I'm back on orthopedics for the first time in 2.5 months.
Wow.
So that was kind of my experience.
Wait, so I want to jump back to your 5th deployment, which is in medicine.
Correct.
Right?
Mm-hmm.
So is this medicine, you said it's specifically for COVID. What kind of medicine are you guys
So medicine, internal medicine service. I don't mean physical medications. I just mean the internal medicine team. Because if you come into the ER with COVID and you need to be admitted to the hospital, the service that you're going to be admitted to is the medicine team. And so if they're having an influx of patients being admitted to their service, then obviously it gets to the point where you have way too many patients and not enough providers. So you need help there.
Which makes
and that's why me and many of my colleagues were redeployed to the medicine team to help them out with their patient load, because it just gets too much. It just gets to be too much, and you just don't have enough people to manage all those people.
So your 5 deployments, that was in a 2.5 month period?
Mm-hmm.
And right now you're an orthopedic. Do you see or fear or have any fortune looking forward thinking in terms of
Mm-hmm.
you, your colleagues, your networks, your friends, your family?
Yeah.
Does anyone believe that there's going to be a second spike?
Yeah. I think everyone does. I haven't met anyone that doesn't think it's not coming.
Okay,
That
so
everyone believes that it's coming.
right, so where we are currently, things are
Uh-huh.
flattened, right? Like in your hospital, you're now allowed to
It's
be.
better than what it was. Yeah. But it's not back to normal in that sense. Like it's like pre-COVID life. I mean, I don't know what our new norm is. People talk about getting back to normal, but normal has to be reestablished now. So what normal is now is not what normal was. So normal might be always wearing a mask. Um, Normal might be always keeping distance. Normal might be that every time we go out, even if it's to go to a restaurant or shop or whatever, it's limitations on people and like how we can interact with each other, how many people can be in a place at a time, and all those kind of things. So, um, so
But is
it's
everyone abiding by that new normal right now? Like when you step outside, we're now
in the
in
hospital,
phase,
yes, because you don't have a choice. Yeah,
right? And in the library, you don't have a choice
yeah,
either.
yeah.
But when we step out into the streets, so right now we're in this whole phase thing, which when phase came about, I was like, what? That's when it hit me. Like, this is really surreal. Because I had been
Hmm.
in my house quarantined still, and I didn't move. Like,
Yeah,
I would wait until my groceries were down to noodles. And then I'm like,
yeah,
well, I'll sacrifice my life right now and go to the grocery store.
yeah,
And now since we hit phase 4, the library
mhm,
is considering reopening. No, we are going to reopen our doors. The new normal for us is a whole different topic.
yeah.
But I live at the riverfront, downtown Yonkers. And
Hmm.
I think it was as soon as, like, maybe even the day before phase 3 came about, that restaurants started to open their doors and put their tables
Hmm.
out on the sidewalks.
Yeah,
And no one was wearing a mask. And it's not 6 feet
yeah,
distancing between the tables. And you can't even get mad at the restaurant owners because they've been shut down for
yeah,
3 months, right?
yeah.
So is that why the spike is going to occur according to, like, I don't know, knowledge-based information?
Yeah, so to me, the way I can only speak for myself and what I think. Um, so I think what people struggled to understand was initially when the pandemic first hit, there was such a huge surge in cases, but I think people didn't understand that it was such a overwhelmed, like the system was just overwhelmed. The hospital just couldn't manage the sheer volume of people coming in. And because a lot of times we talk about social distancing and flattening the curve and things and terms like that, but unless you truly understand what that means, I think sometimes people have a hard time following because they don't really understand what does this really mean. So when I broke it down to some of my friends, like, listen, let's just say in the hospital we have 10 ventilators, right? And we have 20 people that come in that need ventilators. Well, guess what? Flip a coin. Who's getting them? Only 10 of them are getting them. What happens to the other 10? Unfortunately, they might have to die because there's just not enough equipment to go around. I mean, there were instances when like the respiratory team was, busy with one patient and um, like another patient needed the respiratory team's help but they were busy with somebody else, and so like the nurse is calling for them, they're like, we can't come right now, we're busy with somebody else, and then that patient suffers. So what people don't understand is part of flattening the curve is that making sure it's not everyone getting sick at once, but we kind of spread it out so that the system isn't overwhelmed, because unfortunately some people are so sick that even with all the medical care in the world, they just won't survive it. And that is a very unfortunate thing, but that's something that we can't help. But what we can help is avoiding people dying not because they couldn't survive it, but just because we just didn't have enough medical personnel, medical equipment, staffing, supplies to help them. If you could have been saved by just having somebody available for you or having equipment available for you, that could be remedied. And so we don't want people dying for no reason. We don't want people dying because there just wasn't a ventilator available for you when you needed one. And so when you kind of understand it from that perspective, I think it's a little bit easier to understand, because my goal, even though like for as far as I know, I have never gotten COVID. I got the antibody test and I came back negative for it, which I was highly surprised about because my exposure level was so high. But even then, my personal, obviously in an ideal world, I would love to never get it. But I think it's more realistic for me to think to myself that at some point I probably will get it, but my goal is to just get it when the system isn't overwhelmed, so that I can get all the care that I need without overburdening the system and making sure that whatever I may need is accessible to me. So that was kind of what I was telling people that I cared about in the beginning. Like, it may be inevitable that at some point we'll all get this, but let's try to wait until the system isn't overwhelmed to get it. And that's what really brought about trying to make sure everyone stayed as safe as possible and avoided contracting the virus as long as possible, so that when the time came, God forbid, that you can kind of get a lot more reasonable care.
Right. That's really strategical of you. And I think that's a really great message to get into the communities, into society before a second does hit.
Yeah.
So do you think that the hospitals, now that it seems like everyone has went through this learning curve of dealing with what is called a pandemic, right? Something that we haven't experienced, I think, since, I don't know, SARS supposedly, but I'll go back to the bubonic plague, right? And we learned from that, but it seems like we're learning something equally important, rather more important. And so during this second wave, if a second wave does hit us, do you think that the hospitals will be more prepared? Will you guys be more prepared considering what we just experienced?
I think so. Because as I mentioned, I feel like a lot of it was on the fly. We were trying to learn as we went. And that's not a criticism. That's just what we had to do, because this was new for all of us. So now that we kind of have experience with it, we know what to anticipate. I would be hoping that the hospital is just stocking up on supplies right now, so that if we get into that situation, we're not kind of struggling for supplies. I have walked in the hallways where I just see like a mountain of ventilators just waiting there, and hopefully we'll never have to use them, but I'm glad that I see them there. So things like that, I have seen preparation in that sense. And I think what people just have to realize, because unfortunately there are some people that are against wearing masks, that are against social distancing, and they just want their lives back, and they just want to be able to do what they want to do, which is understandable, but at the same time, you kind of have to understand the situation at hand and be a little sympathetic and understanding. But I think unless you are a healthcare worker that's working the front lines, or an essential worker, or somebody who lost someone, or had someone like you or someone directly close to you was really affected by this or passed away from this, like if the only thing you experienced in this entire 3 months was, oh man, I couldn't leave my house and go to happy hour, then I think it's a little harder for you to relate and understand what's going on in the world. Absolutely. And God bless you if that was your biggest inconvenience in the past 3 months. I've heard people tell me like, oh, I'm just so bored. I'm just sitting at home for like 3 months. And I'm like, I wish I could trade places with you. Like, I wish I could just sit at home for 3 months and be thought of as doing my like humanitarian duty of serving the world by just sitting on my couch and watching TV and watching Netflix.
Right.
We don't all have that luxury.
That's your only job, just quarantine.
Yeah. And meanwhile, like, I was working overtimes and working nights and weekends and doing whatever max hours I could. And so that goes back to my original point. Like, I think people that are struggling to comprehend what's going on in this world, you have to be so disconnected to not truly understand that. So if you're just someone that's not hasn't really been affected by this, and your biggest issue has been the mild inconveniences of, oh, what do you mean I can't go out and just grab a drink? What do you mean I can't go shopping for new clothes in the store? Like, then it's going to be a little bit harder for you to grasp what's going on.
Absolutely. And
Yeah.
that drives me to we're still in the period of COVID. Like we said, the potential for a second spike. How does that make you feel? What type of impact does it have on your mind?
So I think
Maybe
a
it's
little
not
bit of,
even something you're completely fully conscious of at this moment because you're still in it.
Yeah. And it's not even like it's gone away. Like, I just got a memo today that, hey, we have to now, in addition to masks, wear eye shields and things like that. So even though things are getting better, like, the requirements are
What's an eye shield?
like goggles or face mask or some kind of eye protective wear in the hospital when we're dealing with patients, just to kind of reduce exposure even more. So there's still things being implemented even now.
Because they
And
still
it's,
don't know the full scope of it.
yeah, I mean, I think it's, yeah, I don't know how else to word it, but like, it's not like we're out of it, right? Like, we're still in the thick of things. And even to this day, I'm still getting new memos and implementations of different policies. But to go back to your question, it seems like almost like you're asking me about my mindset of this pandemic.
The
And
impacts.
yeah, and to talk about that, I think people really have to understand that myself, as well as other hospital or healthcare employees, were really emotionally, physically, and mentally drained by all of this. I know people who were living in hotels for like months because they were afraid to go home. Parents who were living away from their children because they were afraid to infect them. And that's what would also, going back to what we were talking about, that's what would be infuriating. Like, I know people who are literally not seeing their families, living out of a hotel, like not seeing their kids, and people out there complaining about, like, oh, I want to get a haircut. Like, come on. So one of the hardest things for me was even watching my own friends, like my nurses, like the nurses on our unit, who I'm friends with, like, they would come to work with like genuine fear, nervousness, anxiety, afraid for their lives, afraid for their families' lives. And that was hard for me to watch. It was hard for me to see everyone be so afraid and anxious and nervous and scared. So when I kind of think of the negatives, that was one. When I think of the fact that we were all so drained in every sense of the word, that was another thing. The fact that there was no end in sight. So if you tell me, like, Cilin, I want you to do this really crappy job, but it's just for 2 weeks, okay? Like, after 2 weeks, it'll be over and you can go back to doing your normal thing. I'd be like, okay, it really sucks, but at least I know it's for 2 weeks and I can go back to normal. The crappy part about being redeployed and keep being redeployed was I just never knew when it was going to end. And that was the hard thing. If someone told me it would just be up until this point, I could have dealt with it better. But because I knew I could just keep being redeployed indefinitely and this pandemic could go on indefinitely and we had no end in sight, that's also what made it so unbearable, because you're in this really bad situation, but not having a light at the end of the tunnel and not seeing any type of finish line, that's what made it even worse. And I think what compounded it all, even for me personally, was when I'm emotionally, physically, mentally drained, the way I want to decompress from all of that is by spending time with family or a night out with friends, and I couldn't do that. So if
Right.
I wasn't in the hospital working the front lines, I was in my room by myself, quarantined. So imagine treating the mental and physical unwellness of work with isolation at home. That does not sound like a healthy thing at all. It sounds like a recipe for disaster. Um, so,
How did you
uh,
cope?
so I cope by trying to find the positives in things. So, for example, two of my nurse friends who both were um, so overworked during this pandemic, so scared, so nervous. They both got COVID. Both of them were supposed to get married this summer. Both of their weddings got postponed a year. Both of them lost a grandparent to COVID. Um, and this is all bad things. And I look at everything
Are
that's
they
going
okay?
on. Yeah, I mean, as okay as one can be. But for me, I was like, a lot of times I would look at things going on and I'm like, how can I draw positive from this? Let me look at it as, how can I be there for someone? How can I, um, just looking for opportunities to pray for people, from a spiritual aspect of just providing some sort of like, um, hey, can I help you? Can I pray for you? Can I be a friend? Can I, whatever. One of the experiences that I had that really touched me was, I remember when I was working one of my shifts as a tech in the ER, and one of the nurses came up to me and said, hey, listen, can you do me a favor? I said, yeah, sure. What's going on? She was like, listen, like this lady here in the corner by herself, she's very sick. She's going to pass away soon. She's DNR, DNI. She's by herself. Can you just sit with her? Because as you may or may not know, because of the contractability and transmissibility, how contagious this virus is, anyone that dies from COVID in the hospital dies alone. You don't die with family by your side. You don't die with your loved ones holding your hand. You're by yourself and you pass away alone. And there were no visitors allowed. There's nobody to come and be there with you during the final minutes. So many people had to die alone. And she asked me, can you sit with this lady so she could be one less person that dies alone? And I was like, absolutely. So I just sat there, and out of all the months of me being a practitioner and like treating people and helping people and saving people and all that kind of stuff, this experience was one of the ones that meant the most to me, because this wasn't me being a provider. Wasn't me being a practitioner. This was just me being a human being, and just sitting with this lady and thinking, what would her family be doing if they were here? Maybe they would be saying a prayer for her. Okay, let me just say a prayer for her in my mind. Or just kind of keeping an eye on her, maybe just making sure she's as comfortable as can be. So that was kind of one of the experiences that stuck out with me the most. And I'm sure everyone has their stories and everyone has their experiences. So please, like, I urge everyone, like, be kind to your healthcare workers, because you probably don't know their mental state and what they've been through and what they've gone through. And so how I've dealt with all this is just looking, as hard as it is, just trying to find the positives in a negative situation. How do I create something or find something positive in the sea of negativity? And one thing I'm really happy to be working on now is we're doing this program, or we're in the works of doing this program called Resilience, where a lot of it is dealing with addressing the mental health of healthcare workers in our system post-COVID. How do we get them to get back to where they were, help them to kind of regroup and recoup and all these things? So I'm undergoing training for that, and hopefully soon we'll be starting to do seminars and sessions for nurses and other healthcare workers that have been impacted by COVID and are kind of maybe mentally, physically, emotionally affected, and how do we kind of help them get back to where they were.
Going to be
So
very hard to do, because now that, and that makes a lot of sense, that you
yeah.
start with those who take care of the community. You
Hmm.
help their mental first, their
Yeah,
mental state first, and then you dive into the community because you have more of
sure.
a broad understanding, I guess, so to speak. But
Yeah.
one thing I noticed when you speak, Cilin, you
Hmm.
talk a lot about, how your friends, your colleagues, they were experiencing
Hmm.
overwhelm, anxiety. You did say at one point that you felt drained, but
Hmm.
you never once mentioned that you were scared or that you yourself had that fear.
Yeah, so because like I mentioned, like I was never really afraid for myself. It was always, my fear was always for others. And I think in general, I think that's my concern, my fear, my worries are always for other people. It's never really for myself. So that's why even during this, I guess, yeah, you're right. During this interview, I spend a lot of time talking about others, because that's that's really what matters to me, is the others. So when I think of my friends, when I think of my parents, when I think of my nieces, when I think of people that I care about, or even just a random stranger like the lady I spoke to you about, like those are the things that matter to me. So me personally, um, yeah, I mentioned to you, I was mentally, physically, emotionally drained, and the way that I kind of got through it was, and it's a weird question to answer, because I don't necessarily think I ever did, or did anything to get through it. I think I just was just like, I just have to do this. So it's just something I have to do. I have to go to work. I have to work through this thing. I have to then come home and self quarantine. It's not like it gets to the point where, oh man, this is just so bad that I'm just now going to break all the rules and go out and hang out with friends and family and do whatever I got to do and not go to work and all those kind of things. There was no escaping it. So it was just really a matter of just kind of keep going through it until it ends, whenever it does end. It was, and that's kind of what I mentioned that made it really hard. There was no end of the tunnel. There was no light at the end of the tunnel. There was no finish line. There was no period of knowing, hey, eventually this will end, and you'll kind of get to go back to normal. So I just kind of had to just get through it.
Yeah, so these questions are they're a little bit morbid.
Hmm.
They make you uncomfortable. You don't have to answer, but I want to
Sure.
go back to the lady that you were sitting next to, and did
Hmm.
she know at any point that you were there with her?
I don't, I don't know. So she wasn't verbal, like she wasn't able to speak. She wasn't communicating. She just kind of groaned and things like that. So, and she was in pretty bad shape. So I honestly don't know if she knew I was there. She
But
would see me, like her eyes would see me, but I don't know her mental capacity at the time to have the awareness that I'm there. So I'm not sure.
so COVID has this effect on people when they're really, really sick, that they kind of become delirious.
No, it wasn't that. She was just, because it was just so, she was just so sick at that point, and she was so close to dying, um, that she was just so weak and not communicating, that I just can't assume what she was aware of and not aware of.
Understood. Was that the
Yeah.
only person that you
Um, she's not the only, well, obviously there was many deaths, but I think that was the most personal experience that I had, because in that moment I was just kind of sitting with her and not being a practitioner. I was just being, like I said, I was just being a human being.
a
um
compassionate human being?
yeah, yeah. So like I think to me that's why that experience stuck out the most. um and that again was a negative situation, but I was just trying to draw out the positive out of the negative. And I guess that links back to your other question of, that is how I got by. Like for me to get by, I was trying to figure out what is the positive I can draw out of the negative. You're in a really crappy situation. Oh, let me try to pray for you or be your friend or something like that. So
If a second spike were to hit, does the hospital have anything planned?
um I'm not sure, because I'm not on that committee or administrative level where I'm in the forefront of planning the next wave. So if they do, I'm not sure and I can't really comment on it.
What about vaccines? Have you heard of any talks about vaccination or antivirals?
No, the only thing that my hospital was working on was people that were tested positive for COVID and had a high antibody level. What they were doing was they were drawing it from COVID, people that had COVID and survived it and had a high level of it, drawing their plasma and injecting it into, basically transfusing into COVID positive patients. And that was something that my hospital was working on. And from what I heard, it was having positive effects and it was working well. So that's the only thing that I know of that my hospital was working on that was doing pretty well.
Now you live in a family of potential vulnerable people. How do you maintain 6 feet social distance? Do you wear a mask around them?
So this room that I'm in right now, where I'm doing it, this is my bedroom and this is where I stayed. Door closed. I never really left this room. If I left this room, it would just be basically to go to the bathroom, and that's really it. Or if I left this room, it would just be to leave, like to go to work. I work 12-hour shifts in the hospital. So when I'm back, I literally just shower and eat and go to sleep. And then when I wake up, I'm just getting ready and leaving and going right back to the hospital. So I wasn't really here that much. And when I was here, I was always in this room with the door closed. Like I never really left. Unless I absolutely have to. And then when I did in those moments, my parents would just stay away completely. So that's kind of how we handled that situation.
And you're still living like this and will continue to live this way, I'm assuming,
Yeah.
until a vaccination is created of some sort.
Well, no, because this month my parents should be moving out to the new place that I mentioned to you earlier. And so once, hopefully they'll be moving out in like 2-3 weeks or so, or at some point this month, and then I'll kind of be living by myself here, which is great.
But if they were to live there, then you would wait until a vaccination were created, right?
Hypothetically, sure.
Right. Yeah. So I have one last question, maybe a few more might pop up. So
Ask me whatever you want.
Antibodies. You mentioned antibodies, and right now that's what the majority of hospitals, I think, are doing. Any medical facility is testing for antibodies to see if you're positive or negative. I know you're not a doctor, but you have friends who have friends who have friends, and there's this. I have a couple. There's friends of mine that are a couple, and one tested positive for the antibody, whereas the other tested negative for the antibody. And everyone is just trying to figure out how is it possible, because they're a sexually intimate couple. They spend every waking, he goes off to work and she stays home, and she doesn't have the antibody for COVID, or rather she does and he doesn't, either or. So how is that possible?
Yeah, I think so. There's a lot of hypothetical possibilities that we can go into. Number one is if the person that didn't have it, so the virus can have a pretty long incubation period. If she, let's just say hypothetically, she contracted it, if she was in that incubation period, or she was just even in the position of maybe even having the virus and not even knowing it, she would still come back negative for antibodies. The other possibility might be that that somehow, some way, they just got lucky in that she just didn't contract it. It's not a guarantee that, like, I could have it and you could not have it, and we can speak in person, not social distance, be around each other, but it's not a guarantee that you would get it. Somehow, if they just got that lucky that she didn't get it, or like I said, she may have gotten it and be like in the incubation period or be in the active virus phase or not, and not have developed antibodies yet. And so in turn, she's back negative for it.
So an incubation period is kind of like when antibodies suppress themselves. Can you explain incubation period?
So the incubation period, because if you got COVID right now, this very moment, let's just say it entered your body, right away, you're not going to feel symptoms. You don't like all of a sudden test positive for COVID. Like if you got COVID this very minute and I tested you in an hour, you're not going to come back positive for COVID. The virus actually has to replicate and develop in your body and infect your body. So that period of from when it enters your body to when it actually infects your body, that's the full incubation period. And that happens with everything. Like even if you get like the cold or the flu or whatever, like if I have the cold and I sneeze and you breathe it in and it like settles in your throat or whatever, you're not now actively sick. You may not feel that until 2-3 days from now. And I've talked to some medical doctors in my hospital that said COVID might even have an incubation period of like as long as 3 months.
Wow.
So
If
so
that
it
was
is
true,
possible.
then you would have to like constantly test for antibodies, right?
Well, that's why I don't know how useful of a test it is right now. Because, for example, I tested negative for antibodies. I forgot the exact date of my test, but let's just say I tested negative for antibodies last Monday. But then what if I just got it on Tuesday?
Right.
You know what I mean?
Yeah.
So what does that really mean? I think the only data that it really offers me is if I come back positive for antibodies, I know that at some point I did get COVID, but that my body handled it well, and that I wasn't one of those people that unfortunately COVID affected me so badly that I had to be intubated or even worse, pass away from it. I think that's the only real data that it kind of gives me, is that telling me that when I got COVID, that it didn't affect me so negatively that I got super sick, but more so that my body tolerated it well. Unfortunately, right now, we don't even know if getting COVID makes you immune to getting COVID again. So I can't even say that if I came back positive for the antibody test, that means that I'm now immune to COVID going forward. I can't even say that. The only thing I can maybe reasonably guess is that if my antibody level is really high, that maybe that makes me less prone to getting reinfected, as opposed to somebody who got COVID, antibody test came back positive, but their antibody level was really low because it was such a mild case of it, versus someone whose antibody level is super high because they had a more severe case of it, and because their level is so high, maybe they're less prone to getting it again because they have more defenses against it. That could be a reasonable guess, but in terms of how much useful definitive data that it gives me, I can't really say.
Definitely. Same for me. Everyone's, going crazy trying to get this
Yeah.
antibody test. And I'm like, why? Like, what is it going to do for me?
Yeah.
Regardless, I have to go to work. Regardless, whether I have antibodies or not. Like, you summed it up perfectly. Thank you, Cilin.
Yeah, no
And,
problem.
and it makes me think, if, like, for someone like you who's at, to me, you're on the forefront. Okay, there are some people that are, in front of you, but you're in the hospital, you're in the ER, you're around a lot of patients, and you're negative in terms of antibodies.
Yeah, I don't think you could be any more frontline than that, if that's what you're saying. Like,
right.
Yeah, because whether you're a doctor, a PA, an NP, a nurse, that is all frontline. Like, you are all equally right there. So I don't think you could be any more like there. I don't think there's levels to that. Like, because technically, like, you have nurses, then you have NPs and PAs, which are mid-level practitioners, and you have doctors who are doctors. But I don't think one is more frontline than the other, because you're all the frontline, and I don't think there's like levels to that.
And what hospital did you say you were at?
Mount Sinai West.
Mount Sinai West. Do you have friends in other hospitals in the area?
Sure. Yeah. So I started off at what is now known as Mount Sinai Morningside, and then shifted over to Mount Sinai West when I took this kind of lead night position um, for the orthopedic service. And but sure, I have friends that work at hospital special surgeries or Sloan or Montefiore. I mean, name it. I have friends in all hospital systems.
Well, the reason I ask is because one major headline was of the New York Presbyterian director who completed suicide
Oh,
after
I didn't hear about
she got COVID,
that.
and she went away, I think, to recover. And during her recovery, she completed suicide. I was going to ask if, maybe you guys had like a moment of silence or something, or if, any of your friends or anyone in your network can relate to or knows even the director.
Yeah, I don't. I did hear of a healthcare provider that did complete suicide, but I don't know if we're talking about the same case. But I don't know too much about that one. And I haven't heard anything in my hospital in terms of like a moment of silence or anything like that. But what I can say is that kind of, I think, does go back to what we were talking about before, which is the mental health of healthcare employees. And so one thing that, as I mentioned, is I'm really glad that we are doing this initiative of the resiliency training and programming to kind of address that. And I think that's important. I think it's important to not sweep it under the rug or um, just kind of act like, yeah, like everyone deal with it on your own and get over it. To me, I think every healthcare worker should somehow, some way get like mental health services, like therapists, whatever you need. I think that should be accessible for every healthcare worker going forward.
Absolutely. And what do you think would be the right recipe for the community then? You probably won't figure out the answer until after your training, but
Yeah, so there could be, group therapy sessions, community sessions, like, hey, are you feeling some type of way about this since COVID? Like, come join this meeting. Like, let's all just get together and talk and share experiences and heal. I don't know the right answer, but I just know that it's a discussion worth having and it's something that's worth addressing um, to everyone.
so we're going to follow up with you because you're going to have an answer for us after you do your hospital training for the healthcare workers in terms of.
Yeah, and we're gonna lead some sessions, and there's gonna be a lot of it where I'll be pairing up with like a social worker or like a hospitals have chaplains and other spiritual leaders, so we'll pair up with them and we'll kind of lead these sessions and do these sessions. And I'm interested to see how healthcare workers respond to it, how they react to it, how they feel about it, how it helps them. And then once I kind of experience that, I'll definitely touch base with you and we can kind of talk about that some more.
Great. Thank you, Cilin. Is there
Yeah, of
anything
course.
else you want to offer to the community of Yonkers in terms of COVID or anything?
Um, just be kind to one another, love one another, serve one another. Um, be kind to people because you don't know. I mean, and not just healthcare workers and not just essential workers, just anyone. You don't know what people have experienced, the loss they've suffered, their mental well-being. I can see someone on the street and not know the pain and suffering that they're enduring or feeling inside. So just be compassionate and loving and kind of just take care of one another. A mask is a symbol of not protecting yourself, but being selfless and trying to protect your fellow person. So, um, think of it that way and just be open to being selfless and putting others first.